Up here, I'll introduce Dr. Lakkireddy, who's going to speak about biosig. Thank you.
Good morning, ladies and gentlemen. Sorry I couldn't be there in person today, but I'll be presenting to you about the biosig, a new standard in signal processing. I have no conflicts of interest. So the pure EP technology, which is biosig, basically is a system that processes the signal, the raw signals that are required through a special digital conversion, really iterating the electrograms in a improved fashion, I would say. So conventionally, your data acquisition and filtering happens that comes through the catheters. It gets amplified, and most of the times you have a variable amplifier that passes through the high pass filters and the low pass filters and the notch filters. Then there is, after that, you get a fixed gain that subsequently converts the analog signal into a digital signal. In this process of variable gain, there are a lot of things that happen that I think that could potentially impact the quality of the signal that gets generated. And then added to all of that, you have environmental signals, because the current leaks, as we all have experienced in our laboratories, however new and however good that it is, there is still a lot of interference that happens that really impedes the quality of the signal that you get. So the usual low signal to noise ratio due to gain switching, and then the information that gets lost and cannot be recovered in the process. And then the analog filtering may also alter the signal information by ringing effect. So what you mean by ringing effect is when you really apply certain filters to a given signal, so there is a little bit of a wobble towards the end that creates the error band. So as a result of which, you get what is called this ghosting effect that really changes the quality of the signal that you get in these places. So what pure EP does is it takes a fixed gain and basically does the analog to digital conversion and filtering it in a way that you don't lose some of the low frequency and the high frequency stuff that are important, and clearly being able to really help you differentiate the difference between a far field and a near field, and be able to definitively say whether that is a case. So the study done by Dr. Natale and Dr. Alamad's group in Austin really looked at this conventional to pure EP generated signal head-on-head, where the signal quality was acceptable in 93% of the times, and about in 75% of the cases, the signal was superior compared to the conventional signal that you get. And what is the clinical relevance of this? This results in enhanced ability to discern near field versus far field signals, and it also helps to improve the identification of very small fractionated signals that are usually not very easy to recognize. So here is an example of the quality of the signals that get generated. A lot of times, some of these gets filtered out, and you really never get to see what exactly is going on. So here is a very nice example of a very tiny fractionated signal that would have otherwise been difficult to discern on a regular recording system that you're able to pick up on. And right off the bat, you could say that in this particular case, you had more than 50% of the tachycardia cycle length where the catheter distal tip was present. And here is a very good example of a persistent AFib case where pure AFib shows less noise on the distal signal, on the distal ablation catheter, really showing the difference between the near field and the far field. There are sharp near field signals, clearly suggesting a potential substrate that is of value that needs to be targeted upon. So here is an example from our own lab. When you apply the high frequency filters, most of the times the signals that you are otherwise not able to pick up on. This is a case of an atrial flutter where you could see more than 50% of the cycle length of the tachycardia in that particular area, really enabling you to understand a region of interest very quickly as you're navigating the left atrium. Again, this is a case of a post-MACE atypical atrial flutter with the split potentials that are observed on LASSO 8 to 9, really highlighting the possibility of a critical isthmus. which otherwise would typically not be picked up. So you can see the significant amount of fractionation that goes on along here. So these are the type of scenarios where you typically not able to pick up the signals on your regular system, and there is a lot of reliance on the three-dimensional mapping, where sometimes depending on how you tag your signals, you may or may not be able to really identify the exact location of this. And so this is a good iteration of how something as simple as the signal that you already have coming through different channels can really make a difference in the work that you could do. So all in all, this improves the quality of the signal, gives you a better idea of what's going on, decreases the reliance on 3D mapping, and potentially improve your procedural time and the efficiency of the procedures. I appreciate the opportunity to be here. Thank you very much.
Yes, this question is for DJ. DJ, can you talk a little bit about peer EP and where you might see which patient you benefit most from using peer EP, or which type of procedure?
So I would say having good signals, better signals that really act as an adjunct to everything else that you have in front of you makes this case for pretty much every case. So since we have installed the system in our lab over the last 12 months, I would say the efficiency with which we operate has significantly improved. So like anything else, right? I think we got excited. We used to rely on Rand McNally maps, and then we got excited about the automatic guidance systems that you had, and then there was auto driving. I think it's the same thing. We have increasingly moved away from utilizing signals in our workflow and rather depend on three-dimensional map. I'm not saying that three-dimensional maps are not getting better. They're terrific. But there are many times where you are stuck when you totally rely on it and not really see what is in front of us. I think that's what Pure EP does, really taking away the increased reliance on three-dimensional map and a mapper that may or may not be good depending on how well they're trained, but instead have self-reliance and be able to incorporate that data to really enhance your workflow dramatically and get your endpoints much faster.